Finding Hope, the Road to Recovery.
Welcome to today's episode of Finding Hope, the Road to Recovery. This collaboration comes together with the Ayeneh Media Foundation and Tarzana Treatment Centers. Back in January 2025, we opened our first specialty services clinic at Tarzana Treatment Centers. We have a pain medicine department, and today we have our guest, Dr. Jasmin Singh, an amazing pain medicine doctor that comes with us with over 10 years of experience. Dr. Jasmin Singh is our pain medicine doctor. Welcome, Dr. Singh. How are you today?
Thank you, Dr. Espinoza. I'm doing really well today. How are you?
I'm good, thank you.
Good.
I know you've been with us now for a few months, and you've been helping a lot of our patients, particularly with what Tarzana Treatment Centers does best, which is integrative healthcare. Part of this integrative healthcare is our patients that come in with a lot of pain and chronic pain per se. Can you tell us a little bit about yourself, your background, your training?
Sure. So I trained in physiatry or physical medicine and rehabilitation in New York, and then I did a subspecialty in interventional pain medicine at UC Davis up in Sacramento. And we trained in technical skills on how to do certain injections to treat chronic pain, along with other modalities that I'm sure we'll be able to tease out more during our discussion today.
Of course. I know that you've been with us now for 7-8 months, and we have this great, amazing pain medicine department at Tarzana. Can you tell us a little bit of exactly what a pain medicine doctor does and how they help?
Sure. So I know that the term pain medicine can be confusing because presumably anyone in pain will seek a doctor's help. In the medical world, when we talk about pain management or pain medicine, we usually mean musculoskeletal and neurologic issues, so kind of orthopedic and nerve pain, nerve-related pain issues. There are some treatments that are interventional, so you might also hear the term interventional pain management. So essentially, our goal is to diagnose the exact issue that's going on that's causing a patient pain. So we try to key in on that with imaging, blood tests, nerve tests, etc., and then propose treatments to manage that pain, whether it be just alleviate somewhat or eliminate it completely.
What's the most common pain per se that patients complain about when they come see you?
I tend to see a lot of low back or what we call lumbar pain, and knee pain as well. I would say those are probably the top two. There's quite a bit of neck pain as well, hip pain, and shoulder pain also. And the ways to treat all those are slightly different. And we delve into a lot of questions to make sure we're not missing anything. Sometimes pain in the internal organs can manifest itself as a musculoskeletal issue. So once we eliminate that, then we go on to treat the muscle, bone, nerve issue.
I see. So it's an investigation per se, right? If you're saying internal organs, then maybe, but the patient's saying, no, but it's my back. So you actually have to kind of go and do a workup then.
Certainly. Yeah, it's really important to keep our differential diagnosis pretty wide. So sort of what we think is essentially underlying the pain, the diagnosis, have it at the back of our mind. Most patients are in touch with their primary care doctors. So their internal organs or other organs are being investigated, but it's always on our mind, and we make sure that certain conditions are ruled out. For example, gallbladder pain can cause pain in the shoulder blade.
Yeah, exactly. Or sometimes it'll refer to the back and it'll be, oh, my back hurts.
Yes.
Oh,
yes.
I see. Is there a specific age range that you notice pain is more common in, or it could happen in anybody?
We do see it in just about any age range. When it comes to sort of chronic conditions coming about and starting to cause more prolonged issues, I have tended to see more anywhere from early 40s, but maybe more commonly mid 50s onwards.
I see. Mm-hmm. And do you ever get patients that come in and they tell you, I've tried everything, I've gone to all these doctors, but no one's able to help me. The only thing that helps me is Norco. The only thing that helps me is some sort of a narcotic. I just need you to give me this medication. How do you handle that? Because obviously we are in this world where we want to try to avoid that. Are there times that this is actually necessary to use?
Right. So certainly some patients maybe have tried Norco, whether that was the primary method of treatment they received or it's their preference. But in any regard, I like to discuss with them the other options, because there are several options actually that are not opioids that have been shown in the data to help, especially when it comes to treating chronic pain, more long-term pain. We don't see great data that opioids are superior to other methods. And in fact, many times they can end up causing more issues than they eliminate, than they help. So really having that discussion, there are many times where the patient said, oh, I've never tried physical therapy, or I didn't know that there were other medications that could help. That being said, there are times when perhaps treating their pain is best relieved, at least in the short term, with opioid treatment. So if it is not the safest option, which we evaluate with various validated tools. One is opioid risk tool. We ask questions about their health history to determine what is their risk for becoming dependent on controlled substances such as opioids. So if we determine their risk is higher, but we find that, okay, maybe an opioid would be helpful, there are certain ones, particularly buprenorphine in all its forms, that are relatively safer options, and that's because they have a ceiling effect on the respiratory effect. So opioids are known to stop breathing at times, whether in conjunction with other medications or on their own. And so these medications are partial agonists, so they work on similar receptors, but to a lesser extent, and they're certainly much safer with regard to the side effects.
That's amazing. But the patients actually will be like, oh, I don't really know what that means. I just know that this takes the pain away. How do you help them in that sense? Because if they're adamant, like, oh no, I just want this, is there other ways? You did mention physical therapy, for example. Mm-hmm. So is this a group, a team effort too with other specialties?
Yes, actually, that's right. We see with chronic pain medicine that what we call a multimodal approach tends to be quite helpful, and that's involving the help of various specialties: physical therapy, chiropractic care, acupuncture, medications that are not necessarily opioids. There's a lot of pain medicines that are not opioids. And even sometimes it might mean a surgical evaluation. So referring a patient to our orthopedic colleagues or podiatry colleagues or neurosurgery colleagues to see what we can do to best get at the underlying issue causing their discomfort and ultimately help them regain function.
I see. Mm-hmm. I know that, well, Tarzana too now has chiropractic care. And in conjunction with you, have you guys seen any success, especially in pain medicine, while you're using that within our patients?
Yeah, so I have certainly seen patients that are going in the right direction. So many times, chronic pain takes weeks to years to come to a point where a patient is confident that they're going to get quite a bit better. So we're here to shepherd them along the way and encourage them based on the data and based on our own clinical experience. Certainly, I have patients that also don't like to take medications, let's say, and there are some that do as well, but they still get quite a bit of benefit from seeing a chiropractic specialist.
I see. I know that we have this great department over at pain medicine, and we have this fluoroscope. Can you tell us a little bit of what that does and what we use it for?
Yeah, so the fluoroscope is probably one of the most common tools that we use in interventional pain medicine. It's such a great way for us to be able to offer treatments. What it is essentially an X-ray that's not as detailed as a proper X-ray, and it's mobile. We call it a C-arm because it's in the shape of a C, and we take 2D images to try to create a 3D image ultimately to safely do injections. For example, if we're going to be doing spinal injections, naturally there's a concern about the organs, the nerves that we're going near. So this modality lets us be safe in how we're doing the injection.
Oh, that's perfect. So it localizes how you're going to proceed.
It localizes it, yes, and it lets us be very specific and precise with the area of pain, so the patient has a higher chance of feeling better.
Ultimately decreasing the pain, yes, or stopping the pain. Does the pain tend to end? How do you measure success rates within this world?
Right. So there's probably a few different ways that we can measure a patient's response to treatments. And one important way that might be somewhat more objective as opposed to subjective is the activities of daily living, or ADLs, or independent activities, IADLs, that they're able to do. Can you drive? Can you sit? Can you fly? Can you write, sit? All these things. How is their function, essentially? So measuring their function. Their pain levels, we use a visual analog scale, VAS, from 0 to 10, if 10 is the highest amount of pain, can be somewhat subjective because a 10 for one person might be a 5 for someone else. So sometimes that could be more difficult to gauge. But how comfortable is the patient? Are they able to work? Are they able to interact with their family better? And then, as I mentioned just briefly before, their activities of daily living, their other functions. So another method I'll add to that is their range of motion of their joints. Are they able to move more? That's another way to see. Part of it is their comfort level, which is somewhat subjective. So it's balancing both their comfort level with some slightly more objective ways to see how they might have improved.
So I imagine with all these modalities, all these team efforts, all procedures that you could potentially do on patients, it increases their time on staying in recovery and staying absent without using any other medication if at any point they had a history of substance use disorder when it comes to opioids or something like that for pain.
Right, yes. So I have had several patients that have not relapsed due to their pain because we're addressing it. And importantly, they are very determined also to treat their pain in healthier ways that won't lead to unwanted side effects, perhaps, such as relapsing. So aside from the patient being dedicated, I do emphasize to them that these are data-driven techniques, and that these certainly can help them if they put in an honest effort. And also being patient, because sometimes we can't start all treatments at once. But if we take one at a time and see what works, that I like to be eternally optimistic,
Of course,
along with the data, and say that let's find a method that works for you. And I strongly believe it can prevent patients from relapsing.
I see. Does any particular patients come in mind in your short tenure with the TTC?
Mm-hmm. Well, I can't talk about a patient that I had before who actually, just because it is a little bit of a shorter time here at TTC, but I had an elderly lady in about her 70s, multiple joint osteoarthritis, causing her a lot of discomfort. Probably 20 to 30 years prior to her seeing me, she had been placed on opioids, so really a long-term medication for her. She had not done physical therapy, chiropractic care, or even tried other classes of medications that were not habit-forming. I talked with her about the effects of opioids. Of course, many people know that it can be habit-forming, but also very significantly is that it affects the endocrine system, our bone health, our hormonal health, and our brain actually as well. And so over a year, very slowly, we tapered her down and then eventually off of opioid therapy by using these other medications, these other multimodal techniques of physical therapy, et cetera. And I asked her at the end, I said, is your pain the same? Is it worse? Or is it better without opioid therapy? And she actually said, honestly, there's not much difference. I would say I also noticed that her mood had improved. So I imagine the opioids can actually affect one's perception of the world and their mood and their affect.
Course. Are there medications that you use that are not habit-forming in order to help with pain?
Yes, so we have various classes of medications. So we have NSAIDs like ibuprofen and aspirin. We have gabapentinoids that help with nerve pain. There are also TCAs and SSRIs that help modulate the transmission of some pain signals. They are FDA approved for pain. Some patients know them as antidepressants, which is another use for them, but not necessarily the reason that we're starting the medication for this patient.
Of course.
If they do want to wean and be more comfortable, wean from opioids that they've been on long term, we actually have methods to help them feel more comfortable.
So, can you give us examples?
Yes. So one is clonidine. It's used for blood pressure, high blood pressure, but actually makes the patient more comfortable as they're coming off opioids in terms of the withdrawal symptoms. We also have gabapentinoids for nerve pain, muscle relaxants, and sometimes if the withdrawal is just too uncomfortable, we can put them on that partial agonist that I mentioned before, buprenorphine. So it is a much safer alternative. There's still a risk theoretically of respiratory depression, but there's a ceiling effect. So as long as they're taking it as prescribed, it tends to be quite safe. And again, weighing risks and benefits. So yes, it's still an opioid, but if it keeps them off more dangerous versions, it can be a very safe alternative and manage their pain at the same time.
And ultimately help them with recovery as well.
Absolutely, yes.
A lot of our patients tend to self-medicate just because of chronic pains that they've had. Like you told us, lower back pain and neck pain would be the most common things. And our patients tend to do that. But now with your help, it's definitely going to change our landscape at Tarzana Treatment Centers.
We're going to keep trying. We're eternally optimistic. And it's so great that at this point in the evolution of pain medicine as a field that we have a growing amount of evidence, so data-driven, ways to help these patients. And certainly, as we all know, the country is in an epidemic of opioids, among other substances. So we have a lot more techniques now to help people in pain so that they don't feel they have to resort to techniques that may not be very safe ultimately.
Is there anything,
Yes.
of course.
Yes.
Is there anything you would like to tell the audience to let them know, hey, there's help out there. Tarzana can help you with your chronic pain?
Yes, please come see a chronic pain medicine physician, ask your primary care physician. We have injections, other medications. There are partial opioids, partial agonists that we can use. We're here to help you. We're not just going to stonewall someone who feels a certain method helps them. It's just we want to do it safely and effectively based on the data. So there are multiple methods and multimodal as we discussed. So chiropractic, physical therapy. There are many ways to help people feel better.
Where do you see the field of pain medicine going in the next 5 to 10 years?
Mm-hmm. I see that it is going to become more interventional based. I think in the last 20 plus years, opioids tended to be the mainstay of treatment, but we're seeing now the side effects of that, and that honestly, how helpful are they really? Because a lot of these patients still are very uncomfortable. So they're very promising techniques, interventions, neuromodulation, spinal cord stimulators, peripheral nerve stimulators, that are showing good results at this time.
Great. I'm sure Tarzana is definitely going to be in the forefront and helping that way as well.
Yes.
Thank you so much for joining us, Dr. Singh. That's all the time we have today. Thank you for joining us in this episode of Finding Hope, The Road to Recovery. Welcome to our second half of Finding Hope, The Road to Recovery. I have my two new guests, Dr. Ariel Juarez, our dentist, and Dr. Joel Mendoza, our chiropractor. Welcome, Dr. Juarez. Welcome, Dr. Mendoza.
Thank you.
Thank you for joining us.
Thank you.
So today we've been discussing how to help people that are in chronic pain and how to help people that are coming to us for several different reasons, but more important, how to keep them safe and either keep their recovery or help them get to recovery. I know that you guys both see people that are coming in pain all the time. Tarzana has started this new services with our specialty service clinic that has dentistry and it has chiropractic care and obviously with pain management. And it just helps us with this integrated process that Tarzana started over 50 years ago in behavioral health and helping people achieve the best versions of themselves. Can you guys give us examples? Dr. Mendoza, could you give me an example of how does a chiropractor help with pain?
Well, to begin with, chiropractic, we specialize in dealing with the spine, the nervous system, and the musculoskeletal system. Most of our patients that we see do come with either no back pain, neck pain, headaches. So those are the types of patients that we see. My goal with those patients is try to restore function, try to decrease pain, and get them out of pain as quickly as I can so they can help with that recovery process. I know with a lot of patients, they either self-medicate or they're on narcotics. And my goal is to try to decrease the pain as quickly as I can so they can help with their recovery process there.
I'm glad you talked about goals, and I definitely want to discuss that or talk further on goals regarding our patients. But I definitely would like to get your input, Dr. Juarez. You run our dental department at Tarzana Treatment Centers. When you have a patient and you see the patient for the very first time, what's your approach to this patient? How do you start focusing on the patient and then working up the patient for whatever they're coming to see you? What does the dentist do in this sense?
Well, if the patient's coming in for a full exam, we take a full mouth series of x-rays. I do a full comprehensive exam. I check their gums, check their teeth, look for cavities, and come up with a plan to treat them as a whole, treat everything that's going on in their mouth. If they do have infection, we'll treat that first. We'll get them out of pain, but also there are a lot of things that could be happening that we can address, like needing a deep cleaning as well, getting some dentures to replace missing teeth, trying to save what teeth we can. That's what we'll do to help the patients. Yeah.
Oh, this is great. Do we do this all in the first visit, or how do we space that out, or how
the first visit will be the exam and going over the treatment plan, and then after that we'll start with treatment on subsequent visits.
Of course. During those exams, the primary exam that you have with patients, do they ever complain about pain? I'm sure you find stuff if they're complaining. Is there anything?
Yeah, that's always the first question I ask is, are you having any pain?
Oh, okay.
Right, we address that first. That's always the number one concern. But I like to, ask the patients what their goals are. How do they, what do they want out of this? Do they want to improve their smile? We want to improve function as well as then just get them out of pain. Yeah.
Of course, because as you stated, this is a comprehensive care, so it's a little bit of everything, but you're helping in such a big way. You just made the big comment of smile and goals, which is now I'll bring it back to you, Dr. Mendoza. I know that working with patients that are in pain and establishing goals is very important for everybody. Ultimately, we want to prevent people from self-medicating. Yes. What approaches do chiropractors do to help with this? And and if you can give us a couple of goals that you try to set up from the beginning with the patients.
Yes. So, once the patient comes in and we evaluated them and determined that they are chiropractic patients, then we start to set goals. Actually, my goal in the first visit is not to completely get them out of pain. If they're coming in at 8, 9, 10, to be realistic, I try to knock down about 20-30% of pain levels in the first visit. If I can achieve that, I've done something great for them. Now, as far as setting goals for each patient, I'll have an exercise program that can do at home that can help with the process of healing as well and decrease in pain levels.
So in chiropractic medicine, you help with nutrition as well. You help with exercise goals. You help also with the pain that they have. What type of practices do you do during the visits to help?
Yes. So when they first come in, we do a full orthopedic exam, do musculoskeletal testing as well. With every patient, I know everyone thinks chiropractic, we're going to adjust every single time or manipulate the spine every single time. It's not necessarily true. We also have other therapies that we do in office, like muscle stimulation, ultrasound therapy. We also give nutritional advice. I'm very advocate of telling patients to remain active, if they can go on daily walks, stuff like that. Obviously with every patient, everyone has different limitations. So I try to tailor some type of activity that they can do at home to help with that process as well.
Wow, very comprehensive, just like Dr. Juarez, just like you stated with your comprehensive exams as well. One of the things that you definitely resonated with me is a smile. I know myself, when I've been in clinic, when I've seen patients, a lot of patients tend not to have, obviously, good teeth for different reasons. And you've seen that more than any of us. But what can we do to help patients get that smile that they deserve, that they want? What type of processes do we have at Tarzana?
Well, what I try to do is, treat the disease process first. If they have cavities, a lot of the problem with the smile is cavities. So, they smile, you see black spots, you see cavities. So treating those, doing the fillings, if they're missing the teeth, replacing them with a partial denture, a full denture, and treating gum disease, because gum disease is a really big thing that we see in the population. So just giving them an all-around treatment plan to improve their smile and their function so that they could chew and talk.
And smile.
And laugh. Yeah.
Exactly. But can you tell me a little bit more about the gum disease? Is that something that that causes pain? Can you give us...
Yeah, I think gum pain is a big thing that we see. A lot of when we have a lot of gum pain, it feels like we have toothaches. It feels like our teeth are hurting, but a lot of that has to do with your gums around your teeth. They're causing the aching, they're causing that pain. So, treating that and treating the tooth, just doing both is really helpful.
Of course. Yeah. Is that something that you use antibiotics for, or you did mention deep cleanings as well?
Yeah, no, we have an ultrasonic scaler. We do deep cleanings and anesthetize and everything for that to treat the gum disease, and have them keep coming in for their cleanings every 3 months after that, and kind of maintain. It's a long-term maintenance that needs to be done.
Of course. Ultrasonic scaler. Wow, that sounds very modern and pretty high up there. Kind of like the equipment you have, Dr. Mendoza. Yes. You were mentioning you have electrodes. Can you discuss a little bit more about those electrodes?
So we have a device in the office. It does multiple therapies that you can provide for the patient. One of the therapies is muscle stimulation. What it helps do is helps decrease pain, it helps decrease inflammation, and releases muscle spasms as well. Also, we can do ultrasound therapy. So the ultrasound therapy also has the same treatment protocols where you're decreasing pain and you're decreasing inflammation. With every patient, we try to determine if they're eligible for that type of treatment, and we provide it as such.
Oh, wow. Does it hurt?
No, actually, the muscle stim and the ultrasound therapy are pretty painless. They provide actually some good relief. Most of my patients, after getting off of that device there, will start to notice a decrease in pain levels right away. Then obviously I complement it with the chiropractic adjustments, which take them to a higher level of improvement there.
Of course. Within your world,
yes,
patients that are coming in within our other services at Tarzana, I'm sure they come in and you get to hear all sorts of stories of what's happened. And you don't have to get too much into detail of this, but if we have this great equipment, have you seen good progression on patients? Or
yes. I mean, there's about 2 cases that really stand out to me. One was a gentleman, he had self-medicated for years. He's been sober for almost 20 years now, but he was coming in to see me and he had some lower back issues. He had some lower back pain. After a couple of visits, we noticed a significant decrease in his pain levels. He was very ecstatic about the results. He thought he was going to have to live with that pain for the rest of his life. And just to see the dramatic decrease in pain levels in a short period of time, he was absolutely astonished. And so am I. Even in my 20 years, I always get amazed of how great patients respond to chiropractic treatment. Second case was another patient, female patient. She was just coming in for typical neck pain, upper back pain. After a few visits, she said, "You know what, doc? I didn't tell you, I also used to suffer from migraine headaches. I haven't had migraine headaches in about a month here." So those types of results are the kinds of results that we see typically at with chiropractic and at Tarzana Treatment Centers.
That's amazing.
Yes.
That's amazing. I am just very impressed by both of your programs. It blows my mind to see Tarzana grow this much. Dr. Juarez, I know that you mentioned this comprehensive exam where you dive into a little bit of a lot, actually. Is there ways to help patients prevent? Is there preventive dentistry? I know in medicine we have preventive medicine that we can help. Is there anything that you focus on the most within your actual, when you first meet the patient to start helping prevent future stuff? Is there anything?
I mean, that goes with patient education, right? Educating your patient on dental hygiene, oral hygiene, just, letting them know how important it is to brush and floss and take care of it at home, as well as coming in to see the dentist and getting stuff taken care of. I think a big part of what I do in my comprehensive exams is I had a patient yesterday, actually. He came in and he was telling my assistant before I got in the room. He was telling my assistant, he was like, I just have one tooth in the front that's bothering me, and I really just want that one tooth filled. I don't care about any of my other cavities. I don't care about anything else. I only want this one tooth in the front. Number 9, it was like the front tooth. And that's all he wanted, and that's what he came in for. And, as a dentist, it's like, I understand you have one problem. You're coming in for one area that you're concerned about, but I want to take care of everything. I want to give you a healthy mouth. We can't just do one filling. You still have cavities, you still have the bacteria in your mouth. So we want to take care of everything. So when I went in to see the patient, I had that in mind. He only cares about one thing, but I need to get him to turn around and care about everything. And so, I came in and I asked him, are you having any pain? He said no. And I was like, what are your concerns here? And he talked about, I have this one front tooth that I'm really worried about. I had lost the other tooth because it broke and I don't want it to break. I want to fix it. But I had an experience at another office where they told me they're going to have to take it out, do an implant, and I just can't do that. So we had already taken all the x-rays. I looked at the x-rays, I looked at the tooth and I saw, it didn't have an infection. He does have, a lot of cavities in the front, but it's a treatable. And I let him know. I said, no, I can do a filling here. I can treat this tooth. Even if the cavity is so deep that it goes into the nerve, I can still do the root canal and I can do the filling. I could still save the tooth. Because he was very worried about losing the tooth. So I told him, this is a savable tooth, and so are your other teeth, and I'd like to save those too. So, I went through his x-rays. I told him, this is what I see, this is what I want to do, as well as doing the deep cleaning, because that's also necessary, everything in the plan. And, I told him, we can do the front tooth first, but I still want to do everything else. And he was like, yeah, thank you so much for caring. Thank you so much for telling me you could save the tooth. He's like, Doc, you're the best. That's what he told me at the end. So I'm like, I really do hope he continues to come in for treatment and I can treat every part of his mouth, not just the front tooth.
Wow, Dr. Juarez, you made the patient feel at ease. That's something that, unfortunately, with the people we help, they don't get any help anywhere else, and we are their last line of resort of help. And the way you just treated that patient with dignity and respect, that just shows a lot, and how much you do care for our population. I really commend you for that, Dr. Juarez. Thank you so much for that. With all of that, you said x-rays. We do x-rays at Tarzana?
Of course. Yeah.
Can you tell us a little bit about that?
Well, when we first have the patient come in, we take a full mouth series, 18 x-rays, get a picture of every single tooth, every single root of the tooth, make sure there's no infection, and if there is, treat it. But yeah, just coming up, that's part of comprehensive care. You have to have the full mouth series and then do a full exam, like an oral exam. But yeah, that's what we do.
Wow. Do you do x-rays too? Do we have x-rays at Tarzana?
We don't have in-office x-rays. I mean, that's awesome. I wish I had in-office x-rays.
Ask the CEO.
Well, if I do need x-rays or additional imaging studies, or if I need to refer a patient to any other specialty, we have that capability to do as well. I know with the patients that we see, there's sometimes I do need some x-rays or I would need an MRI. We just send out the referral, and in about a week or so, we have those images in office. So it's something that can be done.
So chiropractors they can order imaging as well,
Yes,
and they
we
can
can
help
order.
try to localize or find where the pain is, kind of like in your side, like finding if there's an infection or, okay, so
Correct.
that's, and that helps obviously prevent, or well, not prevent, but actually help in the time being.
Yeah, it helps
to develop a plan.
in the diagnosis to come up with a treatment plan. Obviously look for any contraindications as well in case the patient's not suitable for chiropractic treatment. Even if the patient is not suitable for chiropractic treatment, I can set out a referral to the proper specialist to make sure that they get the care that they're looking for.
What's an average care plan for a patient?
Yes.
Let's just say this is a 45-year-old male that's coming in with lower back pain due to a motor vehicle accident that he had not that long ago, maybe 34 months ago, and the pain's now starting to appear. We see that a lot in the clinics, and in our primary care clinics, we then, let's see if we can provide you something else instead of giving you some hard medication. Can you walk us a little bit on how that process would work?
Well, with every patient, obviously, I have to take a thorough history. Someone that's been in a vehicle accident, obviously, you have to determine how severe this thing was and if there's been any imaging studies performed. At the beginning, with any patient, we do see patients a little bit more frequently, but that beginning frequency stage there does dwindle down over time. So a patient like that, typically, I would like to see them at least a few times for a couple of weeks, and just to see how they respond. If they start responding favorably, then we continue with the treatment. If they don't continue to improve the way I would like, then maybe I can co-manage with a doctor seeing pain management as well.
Oh, wow. You just opened another set of questions for me then. So that means it's integrative care, which is what Tarzana is known for. Can you tell me, maybe both of you guys, do you guys have that, both of you guys share that integrative healthcare? I mean, we do have cool things at TTC.
Yes.
Yeah, sometimes I have patients who can't go far back in the chair because they have back problems,
Oh.
right? And so when I'm bringing them back and they're like, no, my back. And I'm like, okay, so you have some back problems. And then I'll ask them about it and ask if they are interested in seeing the chiropractor or the pain management specialist to help with that. So sometimes I will run into that where I can tell my patients having some other issues with pain that I can refer over to the other specialists. So
That's great.
Nice.
Part of our integrative healthcare.
Yeah.
How about you? Do you have any examples that you can give us?
Yeah, no, absolutely. I get the same examples. There'll be a patient that, I say, oh, I see you've added dentistry to Tarzana Treatment Centers. I'm like, yes, would you like a referral? And they're like, yes, I haven't seen a dentist in years. So then that's when I would set a referral to Dr. Juarez, or even with pain management. If I see a patient is not improving as quickly as I like, or the MRI comes back when I can see that they're going to need extra help, I can set out a referral to Dr. Singh with pain management and usually get that referral done fairly quickly. The one great thing about, Tarzana Treatment Centers, and I'm sure that's why we all joined Tarzana Treatment Centers, is that full integrated health. I think with dentistry, pain management, including myself, chiropractic, we have filled that void that Tarzana Treatment Centers needed, is to become fully integrated and provide full care from head to toe.
Well, I can tell you that when we have patients calling TTC, thanking us for the services that you guys offer, for the services that Tarzana is been offering, it just makes us feel, okay, we're doing our job, helping our community. Is there anything you guys would like to tell our audience, just as a message, hey, we are here to help? Is there anything you guys would like to let them know?
I could start with, exactly that. I am here to help. I really want patients to feel comfortable coming in. I know that most people are afraid of the dentist. And that's every patient that walks in the door. I hate the dentist. I'm afraid of the dentist. But I will listen and try my best to make you feel comfortable. And, I try to fight that stigma every single day by getting my patients not so afraid to come back in. Because I really care and I really want their oral health back
That's
Yeah.
great, Dr. Harris.
Well, I guess my message would be, if you are interested in either seeing the dentist or pain management or even chiropractic, to give us a shot. Even if it's not with Tarzana Treatment Centers, give chiropractic a shot. Maybe this motivates you to go see a dentist, and I hope it does. But the most important thing is to start really taking care of yourselves. I know, there's some rough times during these times, so it's really good time to really start focusing on yourself and really start focusing in on your own health.
Thank you, guys. I'd like to thank you guys for joining us today.
Thank you.
This is all the time we have today in today's episode of Finding Hope, the Road to Recovery. See you next time.
Brought to you by Tarzana Treatment Centers. You can visit our website at www.tarzanatc.org or call 1-800-996-1051.